good to have you this morning.
Pleasure to be on.
Yeah, definitely. When it's close to festivities times, it's good to have this conversation. So someone would even ask, what's not the difference between health and wellness, just to break the ice before we start the discussion.
So, health, as defined by the WHO, is a complete state of physical, mental, and social well-being, not just the absence of disease or infirmity. Now, wellness is an active pursuit in the maintenance of health and prevention of any complications associated with certain conditions. So even if you've been diagnosed with a chronic condition, it doesn't mean that you can't pursue your wellness and your health. Because once you have a condition, what we'd like most people to do is to prevent the complications associated with those conditions.
Perfect. And what about wellness?
Yes, so wellness is the active pursuit and maintenance of health. So this would include partaking in activities that are purposefully designed to keep you at an optimal state of health. This, as we'll go into further, would include things like diet, exercise, actively going for wellness checks at the hospital, even when you're perfectly healthy.
And someone would ask, how often should you go for these health checkups? Yeah.
So it would be good to go for a wellness check roughly at least once a year is a general good rule of thumb. Because on a yearly basis, if something is cropping up, some kind of health condition, it can be caught rather early if you do go ahead to check your health status, essentially, on a yearly basis, even if you're well.
Great. And when you're talking about wellness, of course, there's the issue of nutrition matters, when stress management, when to rest, physical activities, and just surrounding all the festive seasons, you know how much people indulge. So what dietary tips do you recommend for maintaining even a health balance during these festive seasons? Yeah.
So it's interesting because diet is something that's implicated in a lot of essentially lifestyle diseases. A poor diet can accelerate the rate at which you develop certain conditions, common ones being something like hypertension or type 2 diabetes. So with regards to a healthy diet, I like to keep the rules very simple. A healthy diet generally includes essentially fresh fruits and vegetables, a lot of that. Good lean meats, so if you're going to eat red meat, to ensure that it's as lean as possible, not so much fat in it. And then the white meats also generally are very good for you. So things like chicken and fish. And then to avoid the foods that you eat from being fried, essentially, because the oils in those can have negative health consequences if consumed for a very long period of time. And yeah, basically, and to avoid processed food as much as possible. Yes.
What about just rationing the portions, mostly during this season? It might not be easy for many people, but what is it that you need to look out for when even managing your portions to just avoid not having complications come January?
So the thing that it would be good to watch the portions out for is mainly carbs. Things like white rice, ugali, chapati, all of those kinds of things. Just to try and reduce that. Let's say it should take about maybe a quarter of your plate. Not more than half, but I'd say a quarter would generally be good. And then to include as much fresh fruits and vegetables with your meal. So you could have vegetables with whatever you're eating and then some fruits afterwards. And then a healthy serving of some kind of protein. Yes.
And in terms of physical activities, what is it that people need to consider during this time?
So with regards to physical activity, it's one of the best forms of activity in order to prevent the progression of certain diseases or even the development of certain diseases is cardiovascular exercise. Now this can range anywhere from swimming to running to hiking to going out and playing sports with the people around you. The goal essentially is to get the heart beating in such a sense that at least it gets you to sweat. I won't go exactly into the numbers of where we want the heart rate range to be around, but the moment you're doing vigorous enough exercise that you start to sweat a little bit, then you're in a good range where the heart is doing work that's beneficial for itself. Yes.
And just how far should someone go? Because there are people who are living with conditions, the likes of hypertension, or even diabetes, and other physical issues.
Yes.
How far should they go when it comes to indulging in physical activities?
So about 120 to 150 minutes of moderate intensity exercise is advised. And depending on your level of ability per se, this can range anywhere from just walking at a normal pace to a brisk walk to eventually jogging. And if walking is not for you, you could go swimming, you could go cycling. Just, once again, the main goal is just to get the heart beating. Yes.
And in terms of the immune health, what measures can one take to support immune health during times when social gatherings and the increase to exposure to illnesses is concerned?
So one of the major things that I would say is to, during this festive season, not to stop taking your medications. Because if you do have any diagnosed health conditions, if you stop taking your medications, essentially what can happen as a result of just being in the festive season and everything is that it will end up lowering your immunity because your body is not functioning as optimally as it should. Then, with regards to, if you're going for large gatherings, just for the large gatherings to be outside in open space or where there's a lot of fresh air that's ventilating the room. Because during this period of time, it would be very easy to catch something like a cold or, yes.
And, any dietary recommendations to just boost the immune system?
Overall, a well-rounded diet is something which will really help the immune system. Things like vitamin C and citrus fruits and all of those things, well and good, but studies have shown that vitamin C doesn't impact the immune system too much. So if you're just generally eating a healthy diet and you're in a healthy, you're just feeling healthy essentially, that's when your immune system will be working at its best.
And are supplements advisable to take?
So the question about supplements is quite interesting because supplementation simply means that you're not getting exactly what you need from the different sources where essentially you're getting your food from. So, and this is why I keep stressing about diet, because a well-rounded, healthy diet will contain all of the, especially micronutrients that you need, which is what supplementation aims to provide. So, unless it's been shown that you have some kind of deficiency, that's when supplementation comes in. But if you're generally eating a very well-rounded diet, then you don't need any supplements.
And also, during this period, there's a lot of alcohol consumption from people. So what advice would you give regarding responsible alcohol consumption as well as managing substances during this festive season as far as the health part is concerned?
So, as a healthcare worker, my general response to that question would just be to avoid any and all kinds of substances or alcohol in general, because they do have deleterious consequences associated with the overuse of them. But if you must indulge, just 1 or 2 glasses of wine, maybe 1 or 2 beers in a night. Try to avoid the very strong spirits because usually that's where things can become slightly messy. And then of course, Yes, avoid cigarette smoking as much as possible.
Are there, from case studies, cases that you've heard just after this festive season, and probably someone has overindulged, and then the complications later?
So, one of the interesting things that we see while we're at work, especially after the festive period, especially Christmas, because what tends to happen is people go back home, there'll be nyama choma cooked, they'll be drinking lots of beer, things like that, is that in January, it's almost like we get a bit of an epidemic of essentially painful toes. And and by painful toes, what I'm referring to is gout, is something which we commonly see after the festive season, because gout tends to occur when you take in too many substances that contain uric acid.
Yes.
So alcohol decreases the excretion of uric acid, and lots of meat contains the substances which then generate uric acid within the body. And then also what tends to happen, as well as that after the festive season, is that people essentially sometimes take a break from managing whatever healthcare conditions that they have, because they would simply like to enjoy the time with their family, enjoy the food, the festivities and everything, which is completely understandable. It's just that the issue is that the body needs to stay in a steady state in order to maintain health. And so as a result of that, sometimes we see certain complications of certain conditions arising just because patients took a bit of a break from ensuring that their health is in the best position it possibly can be.
Yeah, okay, great. And in terms of just ensuring you have also, you don't indulge so much, but again also have enough rest and even sleep, how important is it during this period?
So sleep is, I cannot stress enough just how important sleep is, because sleep is the way in which our bodies and especially our minds recharges itself so that it can function optimally. One thing which I would encourage everybody to look at during this segment is to actually look up something known as sleep hygiene, because there are ways in which we can set up our environment and certain practices before we go to bed that promote better quality, higher quality sleep, which will leave us more refreshed and recharged in the morning.
What is just a perfect sleep hygiene? Is there specific hours you should do, and is there when there are times when is there oversleeping? That's the word.
So with regards to sleep hygiene, so in terms of how you can set up your environment with regards to having good sleep hygiene. So if I was to go through some of the steps, it would include something like to limit screen time completely by about 1 hour before bed. And if you must use a screen, for it to have a blue light filter present within the screen, because blue light is something which it essentially keeps the mind awake. Then to have some kind of winding down routine. So maybe it could be drinking a hot beverage, or reading something, or some kind of meditation, something like that, just to slow down the mind and for the mind to know that it's time to rest, for the brain to know that it's time to rest. Then with regards to how your room should be set up, if you can have it as dark as possible. So no light coming in from anywhere. And I know in this city life it can be a bit difficult. But if your room can be as dark as possible, that promotes better quality sleep. And then if the temperature in your room can be slightly lower, so maybe if you have a fan in there, that can help, because when your body temperature is slightly below normal, it promotes better quality sleep. Then with regards to with regards to the time you should go to bed and when you should arise, studies have shown that going to bed around 8 to 9 o'clock is beneficial because of the secretion of something known as human growth hormone, which only occurs while you're sleeping at night. So if you go to bed later, things like at midnight, 1 a.m., 2 a.m., the amount of human growth hormone you get is not as much as if you went to bed slightly earlier. And then stick to a consistent time when you go to bed. So if you're going to choose to go to bed at 9 every day, and I know this can be a bit difficult, but every day go to bed at 9. And then when you wake up, you should also wake up at exactly the same time. And the interesting thing with how the body is designed is that if you do this for a couple of weeks and a couple of months, your body instantly gets used to it.
Yes.
Okay, not instantly, it gradually gets used to it. Yes. To the point where when it's 8:30, 8:45, you start to feel drowsy, and then by 9 o'clock you're sleeping, and then if you wake up, let's say by around 6, your body will just wake itself up naturally. You won't need 100 alarms in order to get out of bed. Yes.
Awesome. I didn't even know there's just a lot of things surrounding sleep. But again, in terms of even relaxation techniques, so there are some that you could recommend during this period.
So one of the things I would highly recommend is actually just the practice of just talking to someone. Just if you're able to open up about whatever it is that you're going through, talk with somebody who you trust, and just to be able to laugh about what exactly is going on, whether it's something jovial or something extremely serious. That's something which provides so much catharsis and relief from the everyday stresses of life. Then with regards to other relaxation techniques or exercises, journaling is something very beneficial, where you just sit down and you just write out your thoughts as you, in terms of how you feel. And then there's certain breathing exercises which, if you look up online, can help and aid in the promotion of relaxation. Yes. So those are some of the general relaxation techniques that I would recommend. And then also I think one more to include is mindfulness meditation, some form of it.
Yeah. Yes. And, during this period, so many people are together, they're gathering, people have not met for a long time. And of course, as much as it's a happy season, well, things happen during this period. So how do people ensure that even they take care of their mental health during this period?
So in terms of taking care of their mental health during this period, it would be just to, if you know yourself very well and you know the kinds of things which are negative with regards to your mental health, or that essentially make you feel extremely uncomfortable, you have a lot of difficulty processing it, it would be advised that you try to limit your exposure to as much stressful stimuli essentially as possible. But with regards to that, I once again come back to stressing how important it is to have somebody to talk to, somebody who you feel safe opening up to and sharing about what exactly it is that you're going on. That will go a very long way with regards to safeguarding your mental health during this time when we're all with family and during the festivities and everything like that.
Yeah. And in terms of stress management, what are some of the effective ways that someone can use or use to just maintain or deal with stress during this period?
So in terms of managing people's stress levels, this is where, once again, exercise is something that comes in, where when you go and do some form of exercising, once again, be it cardio or some kind of weightlifting or just any kind of exercise, I find it difficult to explain, but there's a kind of freshness, essentially, that comes to the mind, which then allows you to process whatever stressful moment or time that you might be going through. So that's something which I would advise. And then also to look up different kinds of coping techniques or healthy coping mechanisms that will allow you to process whatever stress that you might be going through during this time. And then once again, I come back to emphasize the importance of sleep, because stress to a tired mind is just the perfect combination for chaos. So if you're very well rested, it would be so much easier to respond to a difficult moment with calmness. Yes.
Okay, perfect. And in terms of just the family well-being and all that, how are there specific precautions to take regarding matters, children and also elderly members in the family?
So with regards to children, it would be very important at least that they have somebody who is supervising them, because children like to wander, they like to play a lot, and with regards to unsupervised play, sometimes it may become dangerous, unfortunately, and it's important to have somebody there who would be looking out for them to ensure that something dangerous doesn't happen. Then for the elderly, what would be very important is in terms of whatever needs to be set up around the house, to limit falls, because falls are something which are very detrimental to elderly people, where an elderly person can fall and can fracture some kind of bone or yes, so that would be very important with regards to the elderly. Yeah.
Okay, great. And in terms of just the general well-being of people during this period, what are some of the general tips for maintaining overall wellness as well as health during this period?
So during this period of time, in terms of maintaining overall health and wellness, it's still the same principles I've been talking about. Getting good quality sleep, a well-rounded, nutritious diet full of fresh fruits and vegetables, lean meats, yes. Then getting in exercise wherever possible. I know during the festivities, everybody will want to see their cousins and family members who they haven't been with for a very long time. But if at all during the day, maybe early in the morning or maybe slightly later at night, to just manage to get maybe 20, 30 minutes of some form of exercise. Yes, and then, as we've also discussed, the different ways of dealing with stress that we have discussed. So in general, and then also, I would say it's very important that prior to going off, going back home, just to have a consultation with your general practitioner or your physician that you see for whatever conditions that you have, just to ensure that you're in good quality health to be able to enjoy the festivities. Yes.
And just in terms of how do people now behave during this period to just prevent and also manage health risks that might arise after this festive season?
The way that can be done is just that it would be important to have some kind of contact with either a nearby clinic or hospital or some kind of healthcare facility in which, should any kind of emergency arise during this festive season, that the healthcare that's required in order to take care of what may be happening can be received diligently and as quickly as possible. Yes.
Yeah. And in terms of even dealing with first aid, just in case anything happens, God forbid, what are some of the steps that someone should look up to when something happens, perhaps to a family member?
This is it's a bit of a tricky question to answer, because it's something which essentially requires training in order to know how to respond. I'm a firm believer that everybody, even just simple bystanders, should know how to do CPR. Because what could happen during this period of time is, and unfortunately we don't want this to happen, but somebody could have some kind of cardiac arrest or their heart could stop or something like that could happen. And while trying to get the healthcare that person requires, if there are people around them who know how to perform CPR, that can be life-saving. And so one thing which, maybe not during this festive time, but one thing which I would recommend that everybody does at some point in their life is either a basic first aid course, or if we're to take that a step further, something known as a basic life support course, in which they'll be shown how to deal with emergency situations as essentially as a bystander, such that if something is going on which requires immediate attention, they'll be trained in the basic principles that can essentially save that person's life while waiting for an ambulance or transiting the patient to a hospital. Yes.
Okay, great. And now, even as families come together, there's now people start having conversations. Probably it's during this period that you learn probably there's a disease that is genetic in your family. Is it advisable also for people to seek medical attention as well as screening during this period?
Yes, because a good number of diseases which can be caught early tend to have a genetic component to them. So certain lifestyle diseases, even though with regards to these lifestyle diseases, the life that you lead is what tends to cause them to come about, there is a genetic component in your predisposition to developing them. Then the major conditions which you should be screened for, which once again can be caught very early, are the different kinds of cancers. So if there's a family history of something like breast cancer, cervical cancer, prostate cancer, colon cancer, just to name a few, there are very simple screening tests which can be done in order to catch these cancers early. So if we were to talk about something like prostate cancer, just doing a yearly prostate ultrasound or a blood test known as a prostate-specific antigen test can help us screen for prostate cancer and catch it slightly early. Then for the ladies, breast cancer is something which, when caught very early, it can be managed very well and the outcomes are very good. And with regards to screening for this, before we even get to the hospital, one thing which I advise all ladies to do is a monthly breast self-examination, where they just check for the presence of any lumps or if anything unusual around that area has been noticed. Then it would be good to get a yearly, if you're under the age of 35, a yearly breast ultrasound, and if you're over the age of 35, then a mammogram. And then with regards to something like cervical cancer, it's important to get a pap smear done. Essentially, once you have your first pap smear done, if it shows that there's nothing worrying or nothing that could lead to something, then it's good to have a pap smear done every 3 years. But if there's something suspicious seen on the pap smear, then a pap smear should be done yearly. And that should also be combined with going to see your obs-gyn.
Okay,
Yes.
great. And people ask, you're always advised to go for checkups every other time. So what exactly should they be going to ask their doctor about?
So during a checkup, first of all, it's very important that you just raise whatever concerns you have about your health. So you'd ask the doctor, how are my vitals? You know, is my blood pressure okay? Is my heart rate okay? Is my oxygen saturation okay? And then if you are experiencing anything that you deem to be unusual, so if you're having pains in a certain area, if you're having abnormal sensations in a certain area, if you're constantly feeling tired, if you're having headaches, just anything. If you don't feel like you're generally healthy, you should raise that with your doctor when you go for a wellness checkup. And then what would be very important as well to do is just to obtain as much information about your health from the doctor that you're seeing. Yeah. Because as we all know, knowledge is power. And when people are empowered with the knowledge in order to take care of themselves, then the outcomes are very good because people tend to act on that knowledge, knowing that they don't want the challenges that come with developing a healthcare condition. Okay. Then, with regards to certain tests that can be taken after a consultation, and you discuss what you're worried about with the doctor, the doctor does a general physical exam on you. With regards to just general wellness, it would include things like a full blood count, kidney function tests, liver function tests, a chest x-ray, a lipids profile. Then there's certain tests which we don't have to do all the time, but it's just generally advised. So something like an abdominal ultrasound, for men a prostate ultrasound, for women a pelvic ultrasound. Then, as we had discussed earlier, things like a mammogram, prostate-specific antigen or breast ultrasound. It's very important, especially for as we get older, also to keep track of our things like cholesterol. So it would be good to do a lipids profile then. And then in terms of, especially where I work at the Karen Hospital, we're very big on heart health. So I would advise a yearly ECG or echocardiogram, then an echocardiogram, which is a very interesting test that images the heart, and then another interesting test known as an exercise stress test, which is a test that allows us to see how your heart responds in response to exercise. Yes, because there's very valuable information we can tease out from that can help prevent something catastrophic in the future.
Okay, great. And just your final words as we wrap up.
So my final words, so during this festive period, would just be to have fun, just to avoid as much stress as possible. If you haven't had a yearly wellness check, then please get it done before you go off for the festivities, especially if you are above the age, I'd say from 40 onwards is when you should be getting yearly wellness checks. So yeah, and then just eat healthy, have fun with your relatives and everything.